everyone. So, we are talking about bone health. Most of us know that as we age, our bone density goes down. But what can we do while we are still young? That's what we're going to find out from Dr. Yadav. Dr. Yadav is one of the leading physiotherapists. He's joining me live from Mumbai. Welcome and namaste, Dr. Yadav.
Namaste to everyone. Today we will talk about the bone health, which is the very important for this normal human being because bone is the structural foundation of your body. It started from the childhood, then we live it in the adulthood, then we live in the our older age also. So bone health is very important as from the childhood only that we have to take care. If we have missed and we can what we can do in the childhood or what we can do in the adulthood or what we can do in the older age. So first we will come about the how do you keep your bone healthy? This is the first question. So that is more important first for this. There's a to keep your bone healthy first that you should take a regular intake of the calcium, which is very important topic today. For the minimum calcium, 1000 milligram is required for the normal adult and for the older population also. In that, second thing that from where you will get the calcium, that is also very important. So try to maintain the calcium level by your foods like vegetables. Milk is the richest source of the calcium, and the quite leafy vegetables which are present like lentils are there, then the palaks are there, all the green leafy vegetables which are very good in the calcium source. And after that you have to add some with vitamin D also to your bone. So vitamin D helps in the regulation of the calcium within your body. With the absence of vitamin D, the calcium will not get absorbed in your body. It will get resolved from your body. So you have to maintain a very good level of vitamin D also. So for the vitamin D, the sources are present. You can take from the natural sunlight. This is the which is the very good source of vitamin D. And by otherwise, you have to take some supplementations are there. By the supplementation you can take that the salmon fish is there, tuna is there, and this high cereals are there which are very good in the vitamin D. And last that for that to keep the healthy bone that you have to do the some weight bearing exercises are very important for the all the individual, for the young children's, teens, elders, adults who are suffering from any disease or not suffering from any disease. The exercises should be a very much important. Exercise play a very important role to the normal individual. It helps to maintain your bone density level. The bone density level with the help of resistant exercise and the body weight bearing, you can maintain your bone health by in a good way. Then we have the lots of questions that if we have the how what to do to increase our bone density level, if we have missed our the calcium supplementation, vitamin D supplementation. This is a saying this never too late to build up your bone density level. If you are too young or too adult, if you are missed, so this is a very good thing that you can maintain your bone density level by the having take of lots of supplementation are present are there. You can take the supplementation for the calcium. Otherwise, use the richer source are the fruits are there, fruits, vegetable, and leafy vegetable. And second, that you have to add on the vitamin D. Vitamin D is the natural sunlight. And after that, the main important is exercise. The weight bearing exercise helps to important to maintain your bone density level. And that we always encourage to the children and adult to away from the abusive substance like nicotine, alcohol, high preservative food which are high in the sodium that leads to the bone resorption from the body. So always we try to avoid to as much as of preservative food and frozen food because frozen foods having the lots of sodium, very high sodium content. The high sodium content leads to this resorption of the bone. So we always avoid as much as you can avoid taking the less sodium that will help to improve your bone health, bone healthy and the density. And the last that what are the exercises you can do for the normal individual, for the young children and for the older population. So the best thing is walking is a very good weight bearing exercises you can go. After walking, you can go for the jogging After jogging, if you are good, if you have the pain or in your joint, then go for the non-weight bearing exercises. What are the non-weight bearing exercises you can do? Non-weight bearing exercises, that is the good thing is like swimming. While doing swimming, it puts lots of stress on your body, but at the same time, it helps to maintain your bone health also. And the second is the cycling. Cycling is a very good endurance aerobic exercise with the weight bearing. If you go for the cycling, cycling helps to improve your endurance as well as improve your body weight also, and helps to improve your bone density also. At the same time, you have to see on the supplementation also. For the normal individual, the vitamin D supplementation before taking that, you have to check your vitamin D level. What's your the vitamin D level comes? So there is a supplementation available. In that, you can take the supplementation to maintain your bone health. The normal individual, you can take the 60 lakh unit is the available to take your yeah, improve the bone density. And after that, the calcium, the 1000 milligram per day, the calcium will be there. If the pregnant lady is there, then it should go for the 1500 to 2000, because the fetus and the mother require the lots of calcium. If the children are there, children also is good. They can go for the 2000 to 3000 milligram calcium per day. So you can add up with the supplement. We can add up with the some foods are available. Nuts are nuts are available like almonds, cashews, that which are rich in the calcium. Groundnut, which are the rich in the calcium, which helps to your body to maintain your bone. And after that, you can add for the vitamin D also. Vitamin D, there is a natural source, and the supplementation, and the last by the help of the exercise. So always we encourage our the teens, childrens, young individuals, and elders. They have to do the lots of not less of physical activity, which is more in the weight bearing activity. Weight bearing like cycling, walking, jogging, swimming, skipping, treadmill. They can go for the treadmill walk also, which will help to maintain your the dense bone density level, which and avoid. And main important, you should away from the abusive substance like caffeine, high sodium, alcohol, and high carbonated drink, which are present the more of sodium bicarbonate, which leads to the resorption of the bone, which can lead to the reduce the density of the bone. So we advise to the normal population, you should be away from the high sodium bicarbonates, and which are very much presence of the sodium in the substance, like frozen fruits are there. So you can avoid by this, and you can maintain the supplementation by the calcium, vitamin D, and the exercise. With the help, your calcium and vitamin D level will pump up.
Wow, that is amazing. A lot of information in quick 10 minutes. I love it.
Yeah.
This is really, really good. And this is supposed to be a quick 10-minute, booster session that we do on a daily basis. Any comments you have, Monica? Anything that you like to ask Dr. Yadav? You're welcome to unmute yourself or put it in the chat window. Any feedback you have, you're welcome to also share.
It was a brilliant session by Dr. Ajay. I just wanted to know specifically, as he mentioned, there's no particular time to get into it and start working out for your bones. But what if, you have severe problems if you're like more than 50, 55 plus and you're not even able to bend properly? So is it like necessary to wear kneecaps or something like that every time, or you should only concentrate on your exercising? Like, how do you actually go about taking care when you're not even able to do simplest of course? So how do you actually take care of your knees and other bones in your body when you're 55 and like 60 plus?
So what do you think, Dr. Yadav?
Yeah. Thanks a lot, Monica. While the ages become more like 50 plus, so we advise some hinges are there, some braces are there, depending upon your body activity. The hinges and braces helps to reduce the stress and over the joint, that will lead to this, that you can able to walk. So we of course always recommend that with the help of precision to the doctors, by seeing with your knee and kneecap, and by seeing the knee condition, by seeing the pain. So we advise the hinge kneecaps are there, that normal compression caps are there, open patella, closed patella. So many hinges and the splints are available. By seeing the different condition, We can advise with the help of that, you can able to walk again and again. With the help of, you can maintain your body density level. At the same time, to reduce the
That's
pain,
very
you have to
informative.
take that vitamin D, calcium, and some exercise prescribed for this, mostly for the, if you're suffering from the knee pain, there's a particular specific exercise for the only knee pain, only for the knee only.
Any comments, Monica? Okay, all right. Yeah, and then, as I think the other thing what I want to also say, physiotherapy exercises, right, Dr. Yadav,
Correct.
especially with the age group, and then some maybe the massage part, right? I mean, although we're talking about the physiotherapy here, but
Correct.
also like some kind of a massages with hot oils, with Ayurvedic hot oils, that could also help.
Yes, 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 yes. If there is that we have to see some particular conditions are there, like synovitis is there, so in that we avoid all the hot things. So always we go for cryotherapy with the cold compression. Otherwise the pain get more of flare up. If the still the inflammation is going on, so we avoid to try to the hot water or hot massage, anything to reduce the inflammation. The inflammation should not get flare up. So in such condition that we go for the cryotherapy. So
So,
cryotherapy works better.
so I think the best would be individualized
Yes,
consultation, kind of
yes,
recommendations or guidelines, Monica, if you have certain conditions, because these are general guidelines that we are just presenting. The other thing is, acupuncture also helps. We are not talking about acupuncture, but
yeah,
that is also,
yeah. That is all the alternative therapy that will also work.
so all these things.
Yeah,
Yeah.
acupuncture helps. That we do the American integrated dry needling. That is also have, that helps to improve the inflammation. And that another thing, that dry cupping is there, the wet cupping is there. That also helps. So many other alternatives also that will also get helps.
Correct. All right. Well, thank you so much, Dr. Yadav. Any other comments, Monica? I'm going to wrap up this session now. Quick 10-minute session every single day. We bring it to you, wellness capsule, and we are bringing in launching a lot of workshops and also free videos making available within the month of December. So stay tuned. Thank you, everyone, and have a great day. Bye-bye.
Thank you.